What is POA indicator? POA indicator is present on admission. Present on admission is defined as present at the time the order for inpatient admission occurs. A condition that develops during an outpatient encounter, including emergency department observation or other outpatient surgery, are considered as present on admission. So POA indicator is assigned to principal and secondary diagnosis as defined in section 2 of official guidelines for coding and reporting and the external cause of injury. So the POA is yes, that is present at the time of inpatient admission, and POA N is no, that is not present at the time of inpatient admission, and POA U is unknown. Documentation is insufficient to determine if the condition is present on admission or not, and W is clinically undetermined, that is a provider is unable to clinically undetermine whether the condition was present on admission or not. I will show you the example of indicators in 3M. So here sepsis, I gave Y as an indicator, which means the condition was present at the time of inpatient admission, and the second one is acute kidney failure with tubular necrosis. I have assigned N indicator, which means no. N indicator means not present at the time of inpatient admission, and third one is dehydration. I have assigned U as an indicator, which means the medical documentation is insufficient to determine if the condition was present on admission, and the fourth one is W. I have assigned for hypertension as W indicator, which means the provider is unable to clinically determine, cannot figure out whether the condition was present on admission or not. Let us see one coding clinic scenario on how to assign a POA indicator. So imagine a patient comes to the hospital with several serious problems, including pre-existing blood disorder and a mild AKI. When admitted, the patient already had mild AKI. During the hospital stay, while in the hospital, the patient developed a very serious infection called sepsis, and this sepsis, which start after admission, then caused a new related kidney problem called acute tubular necrosis. So when in medical coding, we have a rule called when we have AKI and ATN, we have to use the combo code called N17.0, acute kidney failure with tubular necrosis. So here the question is, since the patient has already AKI a part of a problem on admission itself, but the most severe part, that is ATN, developed after admission, then what should the POA indicator be? So the answer is we have to assign N as an indicator because ATN is developed after admission, described by a single code. In this case, the acute tubular necrosis component is a key part of that single code, and it clearly states that ATN was not present on admission. So it developed later because of sepsis. So we have to assign N as an indicator for acute kidney failure with acute tubular necrosis.